Hello everyone, myself Arti Dilip Palve, and today I would like to talk about the clinical data management, and my topic is the clinical data management plan. So the first of one, what is clinical data management? Then clinical data management is the collected, cleaning, validating and maintaining the data collected during a clinical trials. Then by ensuring that the data is correct, comprehensive and dependable, clinical data management plays a crucial role in the overall success in clinical trials. Then the verifying the collecting data in the clinical data management process. Then the objectives to ensure that the data is collected accurate, complete and consistently. Then the or ensuring that the data is entered into the database correctly and on the time. Then it is responsible for the designing and implementing the data. Then it is identified to resolve errors and inconsistencies in the data. um, then the then to ensure that the data is stored in the secure and the accessible manner. Then or This data ensures that the available for the analysis and reporting per the study protocol. Then the roles of the clinical data management. First one is the clinical data management manager, then the study monitor, then the biostatistician, then the data entry log, then the data quality assurance staff. Then the clinical data manager. The clinical data manager manage the data collected during a clinical trials. This includes the planning, designing and implementing the clinical data management plan, creating case report form and overseeing the data entry, cleaning, validation and the reporting process. Then the uh, study monitor is responsible for the GCP guidelines, that is good clinical practices in the clinical trial guidelines, and it is responsible for the collection process and identifying the resolving errors. So then the biostatistician, it is responsible for the designing and implementing the data in the CDM and to give the correct result of the clinical data management. Then the data entry log, it is responsible for the entering the database using specialized software, and it is responsible for the ensuring that data enter correctly and promptly. Then the data quality assurance staff. Then the data quality assurance staff, it is responsible for the monitoring the data process and identifying the errors and manages the data. Then it is responsible for the collection is promptly and accurately into the database. Then the steps of the clinical data management. First one is the planning, second one is the data entry, third is the data cleaning, fourth is the data validation, fifth is the data analysis, and sixth is the data reporting. Firstly, planning, defining the data management, plan and creating the case report forms. Then the data entry, entering the data into the database using software tools. Then the data cleaning, checking the data is clear or not, or which have the correct result or not error in the data. Then the data validation, Ensuring the data meets the requirement for the study protocol. Each data required for the study protocol. Then the data analysis. This data produce the returns of the study result of the study, because so it analyze the correctly. Then the data reporting, preparing the final report of the study. Then the tools of the clinical data management. First one is a clinical data management system. Then the first one is the clinical data management system. Then the electronic data capture, clinical trial management system. Then the electronic patient reported outcomes, and randomization. So thank you.